Can I start?
Yes, madam, you can.
Thank you. So good afternoon and welcome to our webinar hosted by The Hindu and GSK. And we hope you have an informative session. We have two experts in the field of child vaccination. One is Dr. Somashekar, Professor and Head of Department of MS Ramaiah Medical College and Hospital in Bengaluru. And we have Dr. Preeti Sharma, who's a Senior Consultant Pediatrician from Rainbow Hospital in Hyderabad. As you all know, the topic under discussion today for the webinar is 11 key vaccines beyond your child's first birthday. So this is an important subject. Last 2 years at least, vaccines and inoculations and vaccination have been in the forefront of almost all discussions thanks to the pandemic. But in the middle of all that, there is also serious concern about how to build a healthy child, how to build your child's health, how to keep him or her safe from various diseases and conditions. And we hope that you will take away some valuable words of advice from Dr. Somashekar and Dr. Preeti Sharma. As you might know, April, the last week of April is celebrated the world over as World Immunization Week. And I'm told that this time, long life for all is the theme of World Immunization Week. And Dr. Somashekar, would you like to give us a general impression about what you think is the importance and what is the role of vaccines and immunizations in the life of a child, in the world and specifically in our country?
Very thanks for the organization and moderated by ma'am. Very well. I'm happy to be in this forum. Am I audible here? Yes. She has thrown a very question about what's my opinion about this immunization, especially in the pediatric age group in the child when it's growing. Very important. Like, when the baby is born, we think of growth, development, breastfeeding, nutrition, and immunization. Means it is part of their growth. It is not separate entity as such right now. Okay, previously it was considered some medication to be given every month. No, it is part of how we advise breastfeeding. We advise it is exclusive breastfeeding. Like that, even the vaccination also. And vaccination, it is evidence-based. We have seen what is the result has occurred. It's a boom for us. And we have seen we have eradicated few diseases. Polio has been eradicated. Smallpox is eradicated. We have a basic evidence. For 200 years, we have worked for this. Now we are going towards CO, being Prime Minister's CO for the next year program. He is thinking of eradicate tuberculosis. See that what is the changes is going on. And today we both are speaking and talking. It is because of COVID vaccination. We're comfortably sitting. And we are driving through the even adolescent age. Now we are going to the pediatric age also. So definitely it's a long life after what team has mentioned. And we should be part of our any comprehensive care for the pediatric age vaccination. And we'll discuss more on that.
Yes, we will discuss more. Yes, I mean, there has been remarkable work done in the case of eradicating polio and smallpox and so on. And, as we are seeing, there are new strains coming up and children in particular are quite vulnerable. So, Dr. Preeti, what do you think is specifically, as we are talking about vaccinations for children, how important or how vital do you think vaccinations or immunization is for children, in the first year or the first few years of their life?
Hi, thank you everyone for giving me this opportunity to spread awareness during this World Immunization Week. So I, as a pediatrician, strongly feel that after breastfeeding, the best thing you can give to your child is give her or him timely vaccinations. They are that important. As Sir said, they are part of a child's growth and development, and they should not be looked at like as a burden that we have to give an injection. Oh, they are so costly. Not all vaccines are available in the government. No, it's an investment you're making on your child's life, not just their health, but also on their life, because they protect the child from life-threatening diseases. So definitely vaccinations are a must. And even during COVID or any pandemic, vaccination should not be stopped. And our biggest example is the COVID pandemic. Like when the second wave came, the number of people who were hospitalized or who died was enormous. Now with the number of people steadily being vaccinated, we are not facing so many hospitalizations or such high mortalities. So vaccinations are a must, not just for children, but even for adults when they are required and when they are available.
Okay, and
Very nice. Yes.
yes, Dr. Somashekar, please.
Yeah, rightly said. It is part of any of our care, complete care.
It is part of the entire care. It is a part and parcel of the, so what do you, what are the, how do these vaccines work? If what the doctors, just for the lay person, how do they work? If you can just explain to us about the working of a vaccine and, how much they are really important in shielding the child from, life-threatening conditions. If you could just tell us, so that it drives home the fact that no matter what, don't forget to vaccinate your child. If you could just...
It's a simple word. Like, see, in the previous, our elders used to say a few things. I think you have seen your grandmother, everybody used to say, they used to get, children should get 1 or 2 respiratory infection, 1 or 2 diarrhea, 1 or 2 skin infections. And, that is how they used to say, it will come and go. And they used to closely monitor. They used to say in such a way that they are protected against these diseases. The same principle works in the vaccination also. I got a lot of words to say, a technical word to say, herd immunity, innate immunity, all those things not required. Let us think, see, in the vaccine, what vaccine contains? It contains small part of, micro part of the antigen, means the infection material, it is there. It goes to the body after the injection, when they give injection or orally, whatever it is. It creates a mild infection in the body in the safe level. For that infection, body will fight with all the antibodies, protective elements, and that will be remembered in the body. And later, when the babies get exposed to the same infection, these antibodies will go and protect them. It is like creating a, all the soldiers. Soldiers are created in the body so that when the infection occurs in a big way or whatever the way, this goes and fight. And that too, they are done for all the major killer diseases, not that they are done for any simple diseases. That will come and go. These are all the killer diseases. If you take our under 5 mortality or the infant mortality, these are the ones which was causing. So they created or the manufactured or discovered, mankind has discovered these things so that it is like simple, creating a small infection, producing a lot of antibodies in the form of soldier, and that protects against the disease. And
defense mechanism.
Yeah, for that we got a lot of technical words, innate immunity, humoral immunity, cellular, all those things are.
Dr. Preeti, would you like to add to that?
Yes.
Yeah, I think Sir has explained very rightly that you just train the body to fight when the actual disease hits. So these can be like live attenuated vaccines like your measles and chickenpox, where we inject a small part of the weakened germ in the body. Or it could be a killed vaccine like a diphtheria vaccine, pertussis, tetanus, or like a homegrown co-vaccine. Or it could be just part of the germ which is injected. So that next time when the actual disease hits the body will recognize the germ and it will, send all its antibodies to fight against the disease. And that is how we are protected from these life-threatening diseases. Even if the child or the adult gets the infection in that case, it will be mild. Actually, COVID has made it a lot easier to explain these things. As vaccinated people get milder disease. Like even some children who get 2 doses of chickenpox, they may still get chickenpox, but it is very mild. So that is how vaccines work, and they protect us from the complications and the seriousness of the disease, if not completely from the disease.
If, as doctor said, previously a lot of apprehension was there giving vaccine. This COVID has done a lot of work. And especially in pediatric age group, they'll just go to the school as if they're going like any other school. They'll just take the pick and come back. Compared to adults, the compliance in pediatric was good. They never had apprehension or any phobia, nothing was there. They took, and with or without paracetamol, they just left and they were playing on after the vaccination. Adults had a lot of fear, but children were really good because they are all into that vaccination area. For them, it is one of the other next vaccine. So that has made a big difference.
I think we as adults are very good at creating panic amongst our children, which is a sad truth. But yes, that is true. Dr. Sharma, will you be able to share that what are the vaccines that are recommended beyond 1 year of life, and how long is the process from 1 year to when are the first lot of vaccines, to be administered, and what are these vaccines? I think they will be putting up, we'll be putting up a slide for you. And
at 12 months, you have the hepatitis A vaccine, which protects against a type of jaundice, which can be very severe. And there are a few optional vaccines which are also available at this age group. Japanese encephalitis vaccine is being given in many areas in India now where this disease is prevalent. And meningococcal vaccine prevents against a severe form of brain infection or meningitis, which can be given at this age or even up to 2 years. At 2 years also it can be given. So that's a little variable. At 13 months, we can give the second dose of Japanese encephalitis vaccine. It is again a form of brain infection, which is prevalent in many areas in India, particularly in the eastern Uttar Pradesh belt. So in these areas, it is a must to take these vaccines. At 15 months, you will have your measles, mumps, rubella vaccine, your chickenpox vaccine, and your pneumococcal booster. So measles, everybody knows. Mumps is the disease which causes the swelling behind the ears. There will be 2 swellings behind your ear. And rubella is also something like measles and chickenpox. And chickenpox vaccine is there. Pneumococcal vaccine at 15 months of age is the booster of the first 3 pneumococcal vaccines given in the first year. It protects against severe forms of pneumonia caused by this bacteria in children. At 18 months, we again have the booster dose of diphtheria, pertussis, tetanus, and Haemophilus influenza B, along with injection polio is given at this age as a booster. And the hepatitis A, for which we gave the first dose at 1 year, the booster is given at 18 months of age. Between 18 months to 2 years of age, now we are also giving the second dose of chickenpox. Earlier, the second dose of chickenpox was being given a little later, but now between 18 to 24 months, the second dose of chickenpox is being recommended. And at 2 years, again, meningococcal vaccine single dose can be given if earlier the parents have not opted for it. Little bit variation in the first 2 years may be there based on which place you are going to or hospital. That little bit minor variation you need not worry about. Some parents tend to panic. Then beyond 2 years, and the next vaccine set happens between 4 to 6 years of age. That is your MMR booster will be usually given at 4 years of age. That is measles, mumps, rubella booster. And around 5 to 6 years of age, you will get another booster for diphtheria, pertussis, tetanus, and injectable polio. So this is still your 6 years. Beyond this, at 9 to 10 years, you again have a booster of diphtheria, pertussis, and tetanus. And for girls, it is strongly recommended to take the HPV vaccine, also commonly known as the cervical cancer vaccine. So this human papilloma vaccine protects women against cervical cancer, and it has 2 doses given at this age, which is 6 months apart. So this is a very, very important vaccine for girls. Even boys should take it, but for girls, it is 100% they should take it. There should be no options in that. Besides this, influenza vaccine should be given yearly. Till 5 years, it is very strong recommendation to give it yearly to all children. Beyond 5 years, also better to take it. But okay, after 5 years, if the parents decide not to take it, it's up to them. But I personally recommend that everyone should take the flu vaccine yearly. So this is a rough guidance, as I said, based on place to place. Little bit variations in the schedule will be there. So vaccines don't end at 1 year. There are many vaccines beyond 1 year also.
So what is the first vaccine? How early does a child get its for her or his first vaccine? Before she turns 1?
The
Even
first vaccine,
Or at the time of birth?
yes, it's called a zero polio and
Okay.
hepatitis B, both weekly.
Oh, I see. Oh, I see.
And Dr. Preeti has well narrated. Just I want to add this thing. These are all recommendations from an academic body. Okay, both for that academic body, both government officials as well as universal immunization program, the officials will be there, as well as academic pediatricians will be there. They have got a ACVP group is there. They have done these whatever the schedule will be keep changing depending on the endemicity or the requirement or the whatever the population based studies and the surveillance, and it will be scheduled accordingly. So all these vaccines are a must to be given, and she has covered from the 0 day, that is first day, to the adolescent. But vaccine doesn't end there. Even we give vaccination for the pregnant women. We give for the even the elderly. We got vaccines, and as well as those are like immunocompromised patients, as well as those who got high risk patients are there, with surgical patient where they got going for a transplant or anything. We have vaccine. Means to say, vaccine is there for whole life.
It is there for the whole life. What is the vaccine you mentioned, Dr. Preeti, that prevents cervical cancer? That's a new one for children, especially. I was not aware of that.
human papilloma vaccine.
Okay,
HPV.
and how early is it? Should it be administered to the girl
So
child?
we give it at the 10-year vaccine. So it can be given after 9 years, but when they come for the 10th year DPT booster, that time we advise them and we give it.
Okay, that's new. It was not there in my generation for sure.
Yeah.
Not there, it was not there.
Until 26 years of age with very good protection. Even after 26 years of age, protection is there. But okay, then the decision can be on based on a discussion with the doctor. But even all women till 26 years, if they have not taken it, I want to pass on the message. They should immediately consult their physician or gynecologist and go for it. It's a very important vaccine, and unfortunately, awareness is seriously lacking about such an important.
Absolutely, absolutely. Thank you. I will pass on the word to all my young.
She is very clear and bold enough to say this very important of cervical cancer, because if you take the data, 1 in 10 women suffer from directly or indirectly from the cancer cell.
Yes.
And it is so progressive disease, by the time it will be detected, we have passed this thing. So the vaccination is very important, and it is one of the adolescent vaccine to be promoted.
Okay. Thank you very much for that.
Very safe vaccine also.
It is a safe vaccine also. Yeah, I was as the child grows up, vaccination takes a back seat. What, in your opinion, on vaccination compliance after the child's first birthday? This was a question sent to me to ask you. So I'll read it again. As the child grows up, vaccination takes a backseat. Do you think that has happened in your experience? Parents tend to sort of say, yeah.
Definitely. This, especially first year, they'll be very critical and they'll come for follow. After 9 months, somehow it takes a backseat. And for your kind information, I have seen the rural and the semi-urban areas, their compliance is better than the rural city areas.
Oh, I see.
Yeah,
okay.
Because they follow in my experience, what I'm telling, they follow the instructions very carefully. Maybe they'll not comply because of so many risk factors, right from the transport to anything. But in city, more globalization, urbanization, lack of time, and this will happen. But see, the risk factor from their side is a different one. But as a pediatrician or a healthcare giver, anybody, and all are working, Anganwadi worker, Asha workers are doing very good job till 1 year. It is a bonus on us to educate them as the education level increases, see the seriousness. See, when the vaccination comes, vaccination is not just a prick. It is like a small celebration to the family. Everybody comes, grandmother comes, grandfather, both grandfathers will be there, grandmother will be there, they'll come, they'll ask hundreds of questions. And for us, for the pediatrician, it is, we'll not talking about vaccination, we talk about nutrition, growth, development, everything. So I will have a bonding. So when we have such a bonding, it is our duty to explain to them about the next vaccine. And right now we have a small system for that. We have an app for this to remind them about the vaccine, because for this sector of global and industrialized people, and as well as government has released an app. It's called as Indradhanush app. Just enter and it will remain the further vaccine also. In that way, over a period of time, I am seeing the compliance is better with this thing, more education and awareness.
Awareness. Dr. Preeti, you feel the same way about it? How has your experience been? Do you think parents tend to sort of, okay, 1 year, the child is now grown up and, oh, I forgot, okay, aur kabhi kar lenge, kind of a thing?
Yes, there are delays beyond the first year. And as Sir rightly said, they don't take it so seriously. And especially with COVID, the regular vaccination was hit badly. I mean, now I have children who have missed out for vaccines for almost 2 years. And they are lucky they didn't get any life-threatening disease during this time, vaccine preventable disease. So, yes, so I think as Sir said, nowadays there are many apps, many things. It's a lot easier for them. Parents, still they vaccinate us. So you can just download one of the apps which will keep sending you regular trackers and reminders. That's a great boon.
That is to help us keep up.
Yes.
That's great. And you spoke, Dr. Preeti, just now you said about, thanks to the pandemic, how many vaccination dates were missed. So is that a very is it something to worry about for parents if they've missed out some vaccinations, Dr. Preeti, Dr. Somsekhar, or is it okay, you can catch up? Or is there some kind of an age thing?
They can,
Yes.
so they can definitely catch up with it, but vaccines should be given timely to have the earliest protection, the best protection, and long-lasting protection. But now, once they realize they have missed the vaccines, they should immediately visit their pediatrician and get the doses done as soon as possible.
Rightly said, because we are seeing babies are born 2 years back, not at all vaccinated. I'm seeing those kind of children, and we try to give, but I compliment all our pediatricians throughout India. Even during pandemic, they pitched in, taking the risk, they pitched in, and they covered as much as possible, thanks to the fraternity, and as well that now we should reschedule whatever it is. We should reschedule, make sure that they take the vaccine.
I mean, there's nothing. If you have missed it, you've missed it. Just get on and get it done. Get it done. Okay. Oh, what is a vaccination card and why is it important? It's, do you have a kind of a card, like a report card with the schedule on it, and it says why is it important? I think that is quite evident in what you said, because you need to stick to those. Okay. And is there any process of getting it, or anyone can go to a nearest hospital?
Yeah, whenever they go to any hospital, even when they go to an Anganwadi center, forget about these big corporate hospitals, even the smallest centers will give the child a vaccination card where they'll mention the dates. In fact, the government has done a wonderful job. I see patients coming from even rural parts of India where they have gone to their hometowns, nicely in the native language, all vaccines, dates, everything will be written. And then it's very important to keep it, because as I said, slight variations may be there in government schedule, or new changes may come up. So it's important for us to know what all vaccines have been given previously, what all vaccines have been missed. I have found some parents to be very overconfident. No, vaccines are completely done till 2 years now. Only the 4-year vaccine is there. But when I see the chart, I find that they had completely forgotten about the 18-month vaccine. Just to give you an example. So if I don't see the chart, I will presume that they have received all vaccines, and unnecessarily the child will not receive vaccination. So this chart is as important as your child's passport. So please keep it safe. If I know these days, because of the nature of work, people are shifting cities, and I find most of the times it is during this transition they tend to misplace it. So I would recommend go for digital records. There are a lot of apps these days. Otherwise, after each vaccination visit, you can just take a picture of the chart so that you have the records, at least you can store it on cloud or on Google Photos. So have some digital records as well. But it is very, very important. Don't be overconfident that you remember all your child's vaccines. It's not easy. There are technical names. You will get confused. So treat it like some precious gold jewelry and keep it safe.
Yeah, rightly said, Dr. Preeti. Very important to have. And she said that word. Even in government, they give that, in Kannada, we call it as Thai Mogu card, mother and child card. So beautifully that. For mother, all the instructions from the day of conception to everything under vaccination, nutrition, everything is there about safe, including breastfeeding, how to do that. And for the child, not only immunization is there, they got development. Everything right from head holding, crawling, rolling over, crawling, sitting, everything in the picture form is there. If mother notices at 9 months, my baby is not sitting with support, there is a card and as well as a growth developmental card as well as the milestone card is there. She will notice something is wrong and she will inform the Anganwadi worker or Asha worker or the healthcare givers or a pediatrician. That is very important because if you miss the bus there, then we had it. Okay, neurodevelopmental given, developmental milestones have given lot of importance in that card. As well as growth, for the height and the weight and whatever the BMI, everything can be recorded in the chart. And nutrition advice is there. Exclusive breastfeeding, after 6 months start the complementary feed. They are given the complementary feed, what all they can give at home. Like making the khichdi, ragi, whatever it is, they have given it so beautifully and it is like a Bible, I'm telling you. And it will be stored, and as madam said, digital cards are also available nowadays if you forget also. And basically, I strongly recommend this that mother and child card, and very good, and they're done so nicely with all scientific methods.
That's really heartening to know that, there is so much of work and there is so much of development, and attention being paid to infant health and,
Yes.
The building blocks of a child's health, especially in her and or his developing years. Yes. And that is great considering, I don't know the exact data, but I know infant mortality was a big problem and a big issue in our country. It still continues to be, but I hope it is it has come down a bit. Do you think it has come down?
It's coming. It is coming.
It's coming down. It is coming. A lot of it is linked to nutrition as well.
Yes, nutrition. So that's why they started the nutrition program and the babies in the womb. If you take all the government throughout Karnataka, irrespective of whatever the state, they started Matrupurna program where mother goes to the Anganwadi or wherever the primary health center, she will have adequate food and have the safe delivery.
Wonderful. That's really reassuring to know. Recently, there has been a lot of focus and interest and discussions over the influenza shots. So, the shots for flu, I guess that's what it is. So what are your thoughts on that, Dr. Somshekhar?
Influenza is one of the periodical, in the way back, 2 decades back, we had a pandemic like this, COVID, and a lot of death, everything was well tackled by our government, everything. After that, we know it has become one of the problem in our country. Like,
I think we lost. I think Dr. Somshekhar's. Dr. Preeti, would you like to take it up while they set that up? Set that right? Because
yes. So, as I was saying, influenza.
Sorry, Dr. Somshekhar, we lost you for a bit.
Yeah. It is influenza is very important vaccine for the children, especially they are prone for this recurrent cold coughs. Okay, that is we call it as under 5 weeks or small children's weeks or uncontrolled weeks, whatever it is. There the flu is known to cause the mild disease, moderate disease, and it may take to severe disease also. So flu shots has got a definite preventive role in this vulnerable child. As well as in the epidemic, it has got to control the fast spread of the disease. And one more thing, I'm basically myself a respiratory physician, and it has got a role in, especially in the patients with those who are suffering from a lot of wheeze-like symptom or asthma-like symptoms. It definitely avoids the worsening of the symptoms of wheeze or asthma. And likewise, it helps in the elderly patients also, those who are suffering from chronic obstructive symptoms or chronic lung diseases.
Dr. Preeti, would you like to add to that? Because we tend to dismiss it, we've got flu, like as if it, we have not.
It's important.
In our generation, we don't. We said, what are you fussing about? Just a flu.
Yes.
But obviously, it can have serious repercussions given the environment now, which is very different from what it was while we were growing up. So,
So yeah, flu is a respiratory illness. It can have like, very basic symptoms like just your fever, cold, cough, body pains, tiredness lasting from few days to up to 1 to 2 weeks. And what has made it easier for me now to explain to parents about flu is the COVID pandemic. Actually, flu in some ways, I wouldn't say all, COVID causes a lot more different complications, but flu is in a way like COVID. Like most of the people will do fine, but some may require ventilators, some may become very sick, may develop encephalitis. Last year we had a lot of, at least in Hyderabad, I don't know how was Sir's experience in Bangalore, we had a lot of children getting admitted with influenza and para-influenza in our PICU because of the pandemic, there was not much exposure, and when the exposure was there, they were quite sick. And surprisingly, at least this is what I observed in my patients, the uptake or the receipt of flu vaccine has improved since COVID. So now they are more receptive to taking it. Like earlier, if out of 10 patients I was counseling, only 4 or 3 would agree. Now almost 7 are agreeing to take the flu shot. So I would strongly recommend it for all age groups. In fact, as doctors and healthcare workers, we take it every year. We have been taking it every year for many years, especially the vulnerable population, children with asthma, children with heart disease, lung disease, any cancers, with diabetes, children with kidney disease. That age group, it is like no option. They have to take it. But for all children, I would personally recommend it.
Probably recommend it.
She's right, Dr. Preeti. Last year we had a recommendation from our academy that she said that it was like, one of the maybe a risk factors for COVID to get aggravated, or COVID may aggravate the influenza-like illness. So we promoted and given the vaccination safely, and we are seeing good results with those who are taken flu vaccine. What are the symptoms for us less compared to other children? Very important. We try to give during that time. Of course, as she said, the compliance is also increasing with the with the symptoms.
But like you said, I think COVID has sort of scared the daylights out of most of us, and we would like to comply with, because we had, something like this has never happened to anyone in our, lifetime. 100 years ago, there was a Spanish flu, which for the first time, many of us have heard about it now, thanks to the pandemic. So that's great. So I think with the kind of circumstances, this kind of environmental changes that are happening, things which are being adulterated, the quality of food, everything, I think it does make sense to take some kind of precautionary measure for as much protection as it can it can provide. I guess that is the thing. So when did you say the flu shot is to be given in a child? The first flu shot, Dr. Preeti, Dr.
We start as early as 6 months.
6 months, okay. And then you get a boost.
First year it is 2 doses, followed by single dose in a year.
Oh, so it's an annual. It's
strain dependent, depending on the strain, whatever the strain is available, they prepare it.
Okay. So the flu shot is an annual shot that we are supposed to take. And this is up to all ages.
Yes, that's what I was telling, like especially these flu shots and the pneumonia vaccines have done a lot of changes, even in elderly population.
Okay.
There are risks for this kind of respiratory symptoms.
That's right.
Respiratory diseases are very bad in extreme ages, like a very young one and the older one. And these have done a very dramatic role in preventing these diseases.
I think I'm going to go off and take my flu shots. I can't remember when I last took a flu shot.
Pneumococcal vaccine.
Along with
pneumonia was.
Pneumonia as well.
Pneumonia both. Okay. Flu is viral, and for bacteria, pneumonia.
I think there need to be a lot more conversations on these shots. I think now perhaps all of us are a little more receptive after our COVID-19 anti-COVID vaccines. Like you rightly said, now we know that it means business. It's not just some time pass we are likely to dismiss it as. There is one school of thought. I have met a lot of people like that who say, oh my God, so many vaccines. We grew up with hardly anything. What is the big deal? Why are they, forcing our children to take so many? So what are your thoughts on that? I mean, we did not take as many vaccines, to be honest. You know, I'm 60 years old. I can't remember taking so many vaccines. My children took some. So what are your thoughts? Has something changed over the years, over the generations?
Definitely, a lot of like science and health science, especially, is evolving a lot. And as a child, I got typhoid, I got chicken pox, and I got hepatitis A. And that time, the vaccines for these were not available. Now, the vaccines for all three are available. And really, if you ask me to put my child through what I went for typhoid, almost I missed close to 15 days to 20 days of school, and I had a lot of weakness. Hepatitis A, I was out for 3 weeks, and chicken pox, of course, for a week, 10 days, you are out. Do you want that for your child? And luckily, I didn't get any severe complications. There are people who get liver failure because of hepatitis A. There are people who used to die because of typhoid. So people don't remember what these diseases used to do. And I have a lot of parents who tell me, you keep recommending so many vaccines. We hardly used to take, a handful, these sick diseases. So it's with advances, of course, things are getting better. And if you notice now, lifespan of people is increasing thanks to multiple advances in healthcare. So saying that these vaccines are, just some fancy things doctors have come up with is ridiculous. They are built in and they are based on strong data. They are well researched, except for the COVID vaccine, which had to be rolled out a bit earlier because, of course, we know the reason. These vaccines are very well researched and they save lives. There is no doubt about it. They save us from complications. They save us costs. Imagine a working mother having to take off for 1 month because her child is down with typhoid or hepatitis A in today's time. I mean, she will be probably let go in some jobs. So it's not just lives, complications, health costs, and your quality of living. So I would say vaccines save lives. Don't think twice about it. I would recommend all parents and all adults to take the possible vaccines which they can. It does not mess up your immune system. That is just rubbish. And it definitely does not cause autism. That has been proved beyond doubt time and again. Still, there will be a group of people who will raise that autism banner against vaccines. This, I'm sure Sir can also add to that.
Yeah, ma'am, you said about infant mortality. It used to be 70. Now it has come to 2 digits, and maybe around 25 to 30 it is. It should be reduced further. I'm not talking about actual figure. It has reduced drastically. It is only because of this vaccine preventable disease are being controlled because of the safe vaccines and whatever the successful vaccination has reduced the infant mortality. That tells the progress of the nation. Not our technology tells about the progress. It is how we control or mitigate the infant mortality or neonatal mortality tells the progress of the nation. Now we are towards a developed country because of your vaccination. So very important. Previously it was evolving, as Dr. Preeti said, it has evolving. See, first maybe you vaccinated smallpox. After that, later we got BCG, and like that it has evolving. And we are not, for all the disease we can't do the vaccination. There is a lot of limitation. These can be these can be manufactured and can be done. And they are done with a safe vaccine. It is to prepare one vaccine. If you take the flu vaccine, you say, lot of trials occurs. Even for that, even though you were established, like even diphtheria, it's started 50 years back. Now still the trials are going about further safety, efficacy. All the levels of trials will be going level 3, and then only it will be released to the public. And it is evolving. That's very important. Science is progressing, as Dr. Preeti said. Good, she had all the 3 diseases and she came out of that. But during her time, it was 15 days. In the older time, the typhoid means 4 months or 5 months leave. That was maybe you know about that part of it. Now the safe, and it is not only having the disease and the abstinence from the school or performance from the school. It is sometimes mortality. It can lead to any complication. Chickenpox can do anything. So this can be prevented. As she said, one more school of thought is there, and I want to, through this forum, I want to tell, there is an anti-vaccine campaign is also going on, saying that, yeah, that is very bad actually. Like, when I'm sitting and telling about don't take this vaccine, I should think of the other child. It is not for me, I'm talking about this. It is for my child and other children, the community children there. And we should advise the proper one. I am sure that some group is going on where they say against, and it is not the private sector. Government is giving all the vaccines. So please take the vaccine. Wherever you want to take the vaccine, and don't give any negative propaganda on the vaccine, because the children should not suffer, because that's why we are the government or the private sector, they are working day and night for the our future generation. Let us stop this campaigning against the vaccine.
So you make a very strong case. You're right, and as Dr. Preeti said, we are in a time when both parents need to work. They can't afford to take off, and this is an added burden, financial, social, all kinds of burden and situation. A lot of people have lost their jobs, so prevention is always better than cure. I think that's one cliche which I'm very fond of, because and the vaccines do just that. They do just that. That's great. And is there anything else you would like to tell us about vaccinations, Dr. Somashekar and Dr. Preeti, in the sense that what else can be done? What else can be done? Do you think timely vaccinations, timely inoculations go a long way in building a healthier nation, for example? And you have said that. But all this is also tied to nutrition. And I don't know. Yes. So please do share your thoughts with us about why you would reinforce your thoughts and comments to young parents on why they should prioritize vaccinating their children above everything else.
Yeah. Very important. See, vaccination, let us, when you go to the doctor, first of all, vaccine should be given. There's no doubt about that. And when you go to the vaccination, be prepared, know about the vaccine. And first of all, openly ask all the questions related to the vaccine to the doctor. Okay, just about side effects, administration, complication, and what are the precautionary things they should ask. Then it will alleviate their all the anxiety. Okay, then during that, thus the vaccination is the best time where they can catch up with other aspect of the growth and development, nutrition and everything. And vaccination schedule tells about the growth and development as well as nutrition. It also creates a bonding, because doctor will be growing with the child. It is not like any other profession. Even the doctor will be, and he'll be there for the baby to address all the issues. And in meantime, any endemic or epidemic, all the things you can ask the doctor. He will address any special precautionary vaccine or any other new vaccines to come. It has to be. So negative propaganda, all those things will be there. So when you get an idea like this, it should not be given. This is not for our country. This is just there. It causes autism or anything. Go and ask your doctor rather than thinking or googling yourself. Ask the doctor. He's the best person. Or any government healthcare workers, they are the one to answer all these things. And one more important is, whenever we go to the doctor, it is not only that we should know about the vaccine, we should know about how it is stored, how it is being given, what are the types of vaccine, and it should be like same label should be there. And whenever you go to the other side, if you are transferring from Hyderabad to Bangalore to Chennai, make sure that the same kind of vaccine is given, the stickers are put, and the next date is scheduled. So it is universally, we know throughout India that the vaccine has got a same schedule, and we promote the same kind of vaccine for the baby. So please elevate what I'm telling the parents, take out this thing, whatever the ideas about the negative propaganda of vaccine. If you have any doubts, simple doubts also, please ask the healthcare workers or the doctor about the side effect, complications or adverse effect. They will address, and they know how to address the complications also, or as a side effects which are minimally noticeable. It's all done with a lot of invention. Respect that, follow, because if you ask me, I'm seeing the third generation. Like my host, I used to give 2 decades back, they're getting their next generation, their kids, children. Means they're grown safely. That is an evidence of what I'm giving today. What I used to give, 25 years back, they know they are getting their children, means they are grown nicely. They are adapted to the social, what are the health circumstances. Now they are getting, means they agreed, accepted the vaccine, and they want to pass it on to the next generation.
Yeah. Yes, sir has covered most of the points, sir. This is something I feel probably even because you have more experience. What I feel is, sir, the media doesn't give much importance to the other vaccines except polio. I have parents, they'll be only interested. Polio ho gaya na. I mean, polio is done, no? I mean, so I really, in fact, sir, I remember when I was a kid, one ad used to come, ye 6 janleva bimariyan, something about DPT. I remember it vaguely.
Yeah.
I haven't seen any other illness being promoted. I mean, vaccines against any other illness being promoted over media in a long, long time, except for polio. And I feel that is having somewhere a negative impact. And I'm really that a media brand like the Hindu has taken this initiative, but I feel the media role should be strengthened up. Like, ma'am, you are like so well educated and you didn't know that there is a cervical cancer vaccine. That is sad. There are so many women who are missing out on this wonderful thing.
Yes.
So I feel somewhere we should be more, the media or the government should do more like campaigns for awareness about other vaccines besides polio. Polio, we have done a great job. We have been polio free since many years.
Yes, evolution.
Yeah, but at least let's focus on the other vaccines and be more, I mean, more campaigns should be. That is my thing.
I agree with you. I agree. No, I really did not know about the cervical cancer vaccine for such young children. I was not aware of it at all. You're right. I mean, I was not. Maybe others are better.
No, they're not, ma'am. I know that because when I did a video on it sometime back and I got many queries and people were very surprised that there's a vaccine against cancer. So, I mean, that is there. The awareness is seriously lacking about a lot of vaccines. This is just one example.
As rightly said, Dr. Preeti, Madam is there. She's an authority in the field of media. I'm sure she can put a word. No, Madam, it matters a lot. It matters a lot.
All media we should.
Madam, you have taken such a subject. You have a lot of things to discuss, and you have taken such a serious subject, and we are very happy about that. And thanks from our president. And
thank you very much.
But like you can make a big difference. Others, our young journalists will follow that. That's what I mean.
They will. Generally, I think there is. You're right. We do talk about polio. We do talk about stuff which we have already battled and vanquished. But there are so many new things coming up every day, and almost every other day there is a new. I just wanted to ask a very. I don't know. I hope it's not a stupid question, but I have to ask you this. Do you think these inoculations, these vaccinations which are given to children, in the first few years of their life, does it make them marginally safer to the COVID-19 infection? I mean, I'm just asking. It just occurred to me. Does it make them a little more resistant to the COVID-19? To the coronavirus?
Definitely, ma'am. Definitely, these vaccines are very protective. Suppose I'll tell you, if these vaccines are not given, okay. If patient had COVID vaccines, COVID illness, at the same time he had kind of mild pneumonia or viral infection, it will go out of the proportion. It will just go out of the proportion. Okay. So these primary vaccines, they're like a shield for a complicated disease like a COVID. So definitely these vaccines are definitely helpful for any kind of other further, we may burden with other germs also later. These basic vaccines are a must and should be given. I think Dr. Preeti will add to it.
Yes, sir. As rightly said, in fact, sir, there was this theory is that why children are getting milder COVID is because they have already had a lot of vaccines and those bodies may be cross-reacting and protecting against COVID. So though we don't have any obvious proof, but we have seen children have got
it's our evidence.
Yes. So we have indirect evidence, not direct evidence. But and as sir said, if a COVID child gets, God forbid, any other disease, then it will be a task to manage, and then definitely the child will become very sick. So the things which we can prevent first, we should focus on those, and definitely other things will be better taken care of.
There was some theories BCG vaccine has protected the children. Why they are not getting children's severe disease, or why they are not getting the COVID itself? There was a theory on BCG vaccine. There was a theory on measles vaccine being given. So, because that was done, some demographic studies were done, which is not very popular studies because it was first time, but it has shown that some good result with, as Dr. Preeti said, indirectly evidence. So we should take it. That is a protective. So both way.
Both ways it works. Both ways it works. So at least some measure of protection and resistance it offers to the child will not be so vulnerable if he or she has taken these series of vaccines. There are some questions for you in the chat box if you would like to see those. Is it necessary to take the additional vaccines available only in private hospitals? I'm not very sure what Jamshi is referring to.
Yes, so certain vaccines are optional. So those you can discuss with your pediatrician. As sir said, please don't keep anything with you and don't go to Google and to some weird parenting websites where the information is given by parents and certified people. Go to your pediatrician, ask her or him that this vaccine, what are the pros, what are the cons, how much does it really protect? And then you take an informed decision. But for the vulnerable children who have any underlying chronic disease, like I earlier mentioned, cardiac, renal, kidney, severe asthmas, or they have diabetes, those children, they have to go for all optional vaccines also. For other children, it can be decided one-to-one after discussing with your pediatrician.
Yeah, few more question. I'll just add one word for that.
Yes,
the question about resistance to the vaccine, actually there is no resistant word comes. It's not a drug. It is just a vaccine. It's an antigen to induce the antibodies. There's nothing like that resistance. And they asked about catch-up vaccine, very important. That is, catch-up vaccine is nothing but booster vaccine. All the vaccines are not extra vaccine. The same vaccine given in the first 2 years are given at the age of 5 years and the 10 years, so that to increase the immunity. We boost the immunity. That's why it's called as booster doses, very important. And somebody asked about vitamin K and others. Vitamin K is not vaccine. It is there given just to avoid the other bleeding disorders in the newborn because vitamin K deficiency will be there. And vaccines, they started immediately after birth. And one more thing is missing vaccine, we are addressed already. Missing vaccines should be given as per the schedule. And as Dr. Preeti said, they are going to address this. Whenever when you go to the doctor, he will schedule accordingly. And is there any vaccine for the flu or asthma even for yes sir, very important question. 50-year-old male adult, sir, for asthma you just speak to your physician. Definitely they will recommend respiratory vaccines like flu and the pneumonia vaccine, and it's annual, sir. Pneumonia is only single shot will be given, and the flu it's given annually. And vaccination chart, Dr. Preeti already shared about 10 years later. It's what their schedule is. She has said about human cervical work for the girl child, and as well as we give DPT vaccine and measles, MMR vaccines repeated and during that time. For vaccine against TB, they already BCG vaccine has done a revolutionary work and it's been given, and that's why we are very strong with controlling. Now we are going for the eradication also. And what vaccine are given by the government apart from polio vaccine? Government is giving all the vaccine except for few vaccine like typhoid, hepatitis A, and the chicken pox vaccine. All vaccines are given, and booster doses are very important. And
are there any? Oh, sorry.
Yeah. Go ahead.
Someone has asked if there are any contraindications for vaccines. Is it that does it happen ever that some child reacts adversely to a vaccine?
Because Dr. Preeti said, please speak to your doctor. He will address the issues, especially if the child has got some sensitivity. Okay, relatively, or there is no contraindications for any vaccine, except few vaccines are there, especially when giving the measles vaccine or giving the flu vaccines in egg allergy and other conditions. Please just inform the doctor, or if you have got any allergic symptoms, please inform the doctor and they will address the issues. It's not that all the contraindication, few are very anaphylactic reactions are there with egg-related allergy, and just speak to them and they got alternative vaccines for that.
Dr. Preeti, would you like to pick any?
I think sir has covered all, and one question is about the importance of keeping the child's vaccination card safe. We already spoke about that in detail. Yes, should keep it safe. Consider it like a piece of expensive jewelry and keep it under lock and keep it quiet. Keep it safe or keep it digital. easier, and especially with the moving population with work these days, you can keep it digital. And rest, I think Sir has already answered all of them. See, as I said, even here people are asking, does government do any vaccinations besides polio? So unfortunately, people are not even aware that government is doing such a great job and giving all vaccinations, besides a few. So that awareness we have given today. So please get all the vaccinations from a nearby center. In government, you will get most of the vaccines.
So the first few years, the vaccinations that you recommended for children from 1 year to say their adolescents, almost all those vaccines are provided free by the government?
Not all, few are not given.
Majority is given. Majority is given.
But majority, few are not given.
Okay. Because someone has asked.
Passing year, government is introducing more and more vaccinations. So, like pneumococcal, rotavirus, they were not part of the government schedule. Now government is giving. So I'm sure in the coming few years, even the ones which are right now only being given in the private sector will be available in government. Till then, I would strongly recommend, even the ones not available in government, you should go and take them in the private sector. Consider it as an investment on your child's health.
Absolutely.
Nothing, it's not so expensive also.
Not so expensive, because if you take to the other developed countries, it's not expensive. And they ask about keeping the record, and Dr. Preeti has overemphasized on the importance of keeping a record. And vaccines are given newborn, and if you, even in the urban area, rural area, ASHA workers comes and mother child card is there, all the newborn vaccines are given. And somebody has put, please share the vaccine shot. It has been done in the initially. Dr. Preeti has mentioned about infant to adolescent, what are the charts available?
Yes, they want.
And somebody has a video recording of the session. I think Madam will address that.
Yes, they wanted to. Yes, I think it will be available on YouTube.
Ma'am, is it possible to share the chart again? Lord,
yeah, I'm just going to, asking for it.
Just
share it again. You can just.
Yeah, the whole chart, if you can send us now.
Just once
I'll just call. Yeah, and if you can just walk us through it again, because many people have asked.
Many questions.
Somebody has asked, are immunization and nutrition interconnected? Vaccination is per se separate and nutrition is separate, but yes, both are very strong pillars of your child's overall development. So in that ways, we can say, yes, they are interconnected. Yes. And as Sir said, in every vaccination visit, the only thing the pediatrician does is not give your child vaccine.
Yes.
We will the nutrition, we will give the correct nutrition advice, we will assess the development of your child, and even in government, the ASHA workers and the Anganwadi workers are now being trained to do this assessment. So immunization visit works not only for immunization, it is a overall package for your child along with nutrition.
And one more question was, one health worker is there in the group. I'm very happy. And they asked about 100% vaccination. With all your support, we should go for 100%. Right now, it is not 100%. We should go for, our aim is towards 100% vaccination in future.
Someone has asked for a flu vaccine. Is it annual? Yes, it is annual. Every year, the strain changes a little bit. So accordingly, the new vaccinations come out. I think rest Sir has already covered.
I think questions are answered, I think.
Yes. Only the chart, many patients have, many patients have.
I think you can just tell them also once.
Yes, somebody can share it with them.
The chart, there is some technical glitch, but it will be put on the link later so people can access it. At the moment, they're unable to share it. There's some no technical glitch. So thank you so much. It's been it's been really enlightening, and to be honest, many of us did not take vaccination so seriously. Of course, now we are all hyper about vaccinations thanks to the pandemic. So something good has come out of it. And we are so grateful that both of you could spend your valuable time with us. And I think, like Dr. Preeti and Dr. Somashekar said, this is something we are not been having enough conversations about. And I'm sure this webinar will lead to more conversations and more discussions. And we will do what we can, I'm sure, from the media to talk about it a little bit more and spread awareness. And nothing like healthy children for a healthy country. We all know that. We keep talking about it. And the physical health is such an important part of it. And physical health, mental health, they all sort of go together. And thank you so much, Dr. Preeti Sharma. Thank you so much, Dr. Somashekar, for taking time. And it was really enlightening discussion. So have a good day. And
thanks for the opportunity, and wonderful to be with you, moderated by a learned person. And Dr. Preeti, it was wonderful to learn from you. And thanks to the audience, and thanks to the Hindu and all the
thanks for keeping our children healthy.
Thanks.
So great.
Thank you, everyone.
Thank you very much. Bye-bye. Have a good day.
Have a great day. So